We are live again, and we're just going to wait while people join in. We're expecting at least 1,000 people today. Just kidding. We're expecting our moms.
My mom doesn't have Facebook.
Oh, never mind.
No, I'm not expecting
50% of our moms. All right, we've got a few people trickling in. We are live. And please feel free to share this on your page or anybody's page you have access to, if you can hack into it, so that we can include as many people as we need. All right. Hello, everybody. Great.
Hello.
I think some of my clinic team is joining in, mostly because they think I'll fire them if they don't. I'm not going to say yes or no on that one. We'll figure out tomorrow. All right. Well, we'll go ahead and get started then. I'm Jen Bacani McKinney, and I'm the County Health Officer.
And I'm Destiny Wheeler. I am the County Health Department Administrator.
All right, and we are here for your information pleasure. So today we are going to start off with the most important thing besides the pandemic.
Our new shirts.
Our new shirts, courtesy of Shelby Smith.
Courtesy of Shelby Smith.
All right.
So they're backwards to you guys, we know, but mine says COVID-19 coming together at a reasonable distance.
And mine says, it's a virus, not a you. We're all in this together. All right, you guys.
All right.
T-shirts are very important.
Thank you, Shelby.
Thank you, Shelby.
You're a good egg.
All right, so you guys settle in. We've got a lot of things to cover today. There's been a lot that's happened since last week, and we're just going to go for it. And we're going to write down your questions as we go along. So please go ahead and throw those out there, and we'll try to get to everybody's questions today.
Yeah.
Where should we start off? Numbers for today. Do you have numbers for today?
Oh, yes. So, still no positives in Wilson County.
Wait, sorry. I'll go like this. I shouldn't do this. I should do this.
Yeah. No positives in Wilson County. There are 900 cases in Kansas and 27 deaths. And I don't have the number of how many we've tested.
That's okay. We're testing a lot. And that's a question we've been asked is, are we doing a lot of testing, or are we just not testing people? Trust us, we are testing people, and they're coming back negative, which is great, and we want to keep it that way. So keep doing the things that you're doing. If you're doing the right things, if you're doing bad things, and do other things besides the bad things.
Right.
That's our solid advice.
No.
Only do the good things, like social distancing. All right. So those are our numbers. Still no positives in Wilson County. But remember, we are surrounded. Almost all the counties around us have it. So it's not the time to let down our guard. We have to stay our course.
Oh,
we have to stay.
We tested 48.
Thank
you, Cassie.
Cassie's always a good one to have too.
She is.
So we've got to stay the course. Last week, Destiny invented the word vigilant. Vigilant. Yes. And so we're going to keep using that, because be vigilant and diligent with your staying home.
Yep.
I don't even know.
I don't know.
All right. So let's talk about, a lot of people are talking about the expected peak in Kansas. So Destiny, we'll have her talk about that.
Yeah. So the expected peak for Kansas is toward the middle end of April. They're saying April 24th. And I want to be really clear about what the peak means, because I think there's a little bit of confusion about that. If we're looking at this as like a mountain, every day we get more new cases, and every day we get more new cases.
Yeah,
so we started out getting 1 or 2 new cases a day. Now we're getting like 40 or 50 cases a day in Kansas, and nationwide it's much, much higher. So that number per day is going to go up and up and up, which is what makes going up the mountain. And then at the top, I don't know what our peak number is going to be, but let's say it's 100, because we haven't gotten there yet. It's 100 a day. So that's the most new cases we're going to get in a day. So that is the peak. But on the way down the mountain, you're still going to get new cases, just not as many every day. So the peak comes, and then that's not the time. It's not just going to be over. After the peak, or the 24th is what we're saying. We're still going to have to be diligent, because if we aren't, then that could go back up again, and we could get more new cases every day. So that's what the peak means. It means the highest number of new cases per day. That's the peak.
Yes, so thank you. That's perfect. I think people, we've been hearing people are a little bit confused, like, great, can we go back to doing things normally in May? The answer is probably no.
Probably not.
Yeah. We have the stay-home mandate in Kansas until April 19th. Can we go back to doing normal things after that? Probably not. And is there going to be an extended stay-home mandate? Probably. Yeah. Oh, see, we're getting so good at we're going to try to say things together. Okay.
It's going to be bad.
What is it that you have to say?
Jinx.
Oh, yeah, jinx. And then you can't. So, in our infinite wisdom and jinxing, we are going to just request that everybody assume that we have a long road ahead of us. So please just be aware. We've seen it in other countries where they said, even in China, they had said, okay, well, let's go back to, some more public outings and opening up things. And then all of a sudden you see swarms of people out there, and then we know that what's going to happen next is there's more cases.
Yeah. And what will probably happen is that once we see that downhill thing, a few things will start coming open at a time. Some people will go back to work. Some people will go on and do these things. Maybe groups, instead of 10, go to 15. It's going to be small steps, just so we can make sure that we don't push that trend back upward.
It's not like unleash the hounds and
no.
everybody.
Yeah.
So,
we're not, it's not going to be that way.
So some of the other things, we have we're writing down some of these questions, so please feel free to keep asking questions along the way. Some of the things that we want to just kind of stress, the stay-home mandate. It's there are multiple parts to this. I know we mentioned it last week, but there are multiple parts to this. It's not just social distancing. So the questions we get are, well, can my friends hang out, but we just hang out 6 feet apart? Or can we have a play date, but it's just the neighborhood kids or something? So the answers to that are no. We can't have play dates. We can't have people hanging out just even if they're 6 feet apart. Social distancing is part of the state mandate, but it also includes essential travel, avoiding non-essential travel, and only doing essential travel. So that would mean that we don't want people just driving out of the county or necessarily like within the county. This week the state came back and said that we couldn't do those cruising nights, and so we know that that's been a big part of like community pride and everything, and we hate to discourage that, but we also, more than hating to discourage that, we want to keep our county safe, and that's the most important thing.
Yeah.
So social distancing, non-essential travel, and then also the mass gatherings that we want to keep gathering small. When we have to go out, we have to social distance. When we have to be around other people, it's a small group of people.
Yes.
All right. How about, look at all these things that are on our table. Cloth masks in general, that has been a hot topic, right? It sounds like so trendy.
Yeah.
Hot topic.
It is a hot topic.
Okay, so let's start talking about them.
Okay, so there are different types of masks, and that's what we wanted to kind of show you guys today. Some of these, first of all, I have to say thank you to Barbara Noah
who is watching. Hi, Barbara.
And Sharon Edens for loaning us these masks. We will wash them and get them back to you, I promise, on your porch. But okay, so cloth masks are specifically for, and I have lipstick on, so I don't want to put these on, but specifically for keeping your droplets in to you, keeping them inside the mask. So if I were to cough, then my spit is not going to fly all over the place. I don't know if you can hear me if I'm talking behind the mask. If I cough behind this mask, my spit's not going to fly all over the place and all over these surfaces. It's going to stay inside this mask, and that's the point of that. They're different kinds. There's like these ones that tie. Barbara gave me this one that has the elastic that goes around your ears. Also, very smart to use different colors on the inside and outside, so you don't switch it around. This one's nice.
Yes, look, easy to make also.
Yep.
And so the CDC recommendation for the cloth mask is when you are out in public. So we as healthcare providers, healthcare workers, your nurses, your EMS people are not wearing these to work. These are ones that when you go to the grocery store, when you have to be out and about, then you should wear a mask. And we're really encouraging everybody to wear them. Like right now, it's a little awkward because when we go to the store, only like 1 or 2 people have them on. But the way this is going to work for everybody, the way it's actually going to protect us all, is if everybody wears them. Because if we keep everybody's droplets away from everybody else, then we're protecting everybody.
Yeah, and Kim says, keep your snot to yourself, and that's exactly right. You don't want someone else's snot on you right now.
My sister told me that it's a good saying to practice your breakup lines and say, it's not you, it's me. And that's what these masks are. It's not your droplets that we're keeping away from people. It's me. It's my droplets with these cloth masks.
Just in case you have come in contact with the virus and you don't have any symptoms yet, but you can still expel it. So that's
Right.
there. And then, so the next most effective mask is a procedure mask.
Or a procedure mask, surgical mask. They're similar. They're not exactly the same, but similar. So these have they have a little metal piece in here so that it forms against your nose so that you get a good seal. It's made of a certain material here so that it can keep out the viral particles. And then, they were intended to be used for single use. Nowadays, your healthcare providers are using masks multiple patients, multiple days even at some points, but we try to use them until the masks are either dirty or they've come into contact with what we think are somebody's droplets. So we get rid of them immediately. So, but we want to save these for healthcare workers who are kind of in the line of duty because we want to protect our patients from our droplets. We want to be as safe as possible, and we want to protect each other.
Yes. So as far as masks go, the ultimate protection for your healthcare provider is an N95 mask, which looks somewhat like this. This is just one that we have at the health department. This is designed to keep someone else's droplets out. That's why it's so important for healthcare workers to wear these, because they're well and they're treating sick people, and we need to keep those droplets from getting to their mucous membranes. So like this, and they've got both straps on, and they're incredibly uncomfortable, but they're much safer for your healthcare workers than some other. There are also particulate masks and things like that, which aren't as effective, but are still more effective than the fabric.
And you might see in some of the states where people are really getting hit hard. I don't see any of my New York friends on here today, but they're getting hit really hard over in New York. In places where they're having a lot of people, they might wear the N95 mask and then also a surgical mask over it to help preserve the N95 mask. Yeah. And so there's a lot of ways that we're trying to make sure that we have enough of this personal protective equipment, but we use it as much as we need to, but we use it as long as we can.
Yes, and one thing I want to say about these fabric masks is I've seen it going around on Facebook to put them in the microwave and cook them for a certain amount of time. We do not recommend that. If they aren't 100% cotton, they can catch on fire. And I don't think you want something germy in your microwave. It's better just to wash it. It is fabric, so just wash it.
Wash it in the dishwasher. So for viruses, just remember, viruses are not technically alive, right? So they are made up of like RNA. I mean, they're not a full being, right? So that is why it's so important to wash our hands, because when we use that soap, it breaks down its barriers and it breaks it open and it's gone. It's not dead because it wasn't alive, but it's gone. So that's why we tell you it's okay to use soap and water or detergent for your mask. It's okay to use soap and water when you're washing things that come from the store. So you don't have to go bleach crazy. You can actually just use soap and water.
Yeah, and Phil, the particulate masks are good. They're not as good as the N95 masks, but they're still good. They're better than the cloth masks at keeping other people's particulates out.
Yes, but still, if we were really to say what's the one mask that protects the wearer, that's only the N95 mask, the official N95 mask.
Yeah.
All right.
Yeah, so we don't want...
that's clear.
Yeah.
That's a lot of N95.
That's a lot of masks.
And people ask what they can do, and so there's a lot of people making masks, and people can have multiple masks. This is great. Deanne Rowe, her mom made this for us, and I know the hospital has gotten a lot of these. What they are just little headbands that go around your head, and then they have a little button, so instead of putting the mask around your ears, it saves your ears and it just goes around your button, so they can be very cute. And Maddox Small, he made these for us, and so they can actually attach the mask behind your head, so you don't have to put them behind your ear, right? Is that
yeah. So you don't have the headband, but
isn't that great?
Yeah.
See? Oh, good job, Maddox.
People doing good things.
So thank you, and we know that everybody kind of feels a little bit helpless right now, but these are great things that you guys are doing and contributing. And really, we're not helpless. Just again, as a reminder, we're not helpless. The things that you are doing, staying home, avoiding non-essential travel, those are the things that make us have some control over the situation. Alrighty, masks. Such a good time. Yes. Alrighty. If you want to go to the CDC website, they also have ways to make masks that are easy, that you don't even know how to, or you don't have to know how to sew. You can just fold them and put rubber bands and stuff. Let's see. I think we need to talk about churches, because this is, for some people, this is Easter week. So we want to address that.
Yeah, so the governor, in the governor's stay-home order, she made churches an essential function, which we believe they are. In her mass gathering order that was just updated today, churches are not exempted from mass gatherings. So what that means is that under their roof, they cannot have more than 10 people. Yes. Period. I mean, that's it. That's what it means. So we know that, there are, obviously there's this platform, there's recordings, there's an FM broadcast option.
It's 2020. You can get to church if you want to get to church.
Yeah.
Hopefully.
So we just, that's new news that just happened.
And we see comments, and we want to be sensitive to people's comments on these things. People worry about, is that somebody's constitutional right to practice their religion? Absolutely. And nowhere is anyone saying that we don't want you to practice your religion. Please practice your religion. Pray a lot for everything that's going on and the people that have coronavirus. But what that means is the practicing of your religion just has to look different for right now, for the sake of saving people's lives. And that's it. So you can be in the parking lot. We had one successful, that we know of, we have one successful service that went on this last week. And a shout out to Pastor Ray and the Grace First Church, because we developed the guidelines together on how to successfully do a parking lot service, or a drive-in service is how they called it, and not put people in danger. And that included keeping people in their cars, or else they may be asked to leave. They could only roll down the driver's side window. They couldn't pass anything from person to person, like even communion or music on pieces of paper or collection baskets. They could only arrive a certain time before and had to leave right afterwards. They couldn't use bathrooms in the church at that time. And I think if we can do those things and not say why something can't happen, but make plans on how we can make them happen, that's how we're going to get through all of this together. It's not about stifling anybody or restricting anybody. It's about figuring out the ways that we can make it happen, even despite this stupid virus that's happening.
Yeah. So there was a question about essential travel as well, and essential travel is travel to the grocery store, travel to your essential job, travel for health care, and that includes to the hospital, and even out of county sometimes. That is still essential travel. Mm-hmm.
And so if you have questions about essential essential travel, then please ask us, and we may need to consult the state with that too, because it's meant to be not exactly black and white also. I mean, there's a lot of things that we have to kind of figure out together also. So another question was, is anyone at the doctor's office taking hydroxychloroquine? Really great question, simply because I want to address that. Hydroxychloroquine at this point, and azithromycin, if you've heard about those medications for this, they're only being used when people are severely ill, when they're at the point of respiratory distress. And so if you've heard people talk about taking it prophylactically, like meaning that they take it before they have symptoms if they've been exposed to someone, that's not the way we're using it. We only have limited supplies of that also. So we need to wait and save it for our most severely ill patients, because if we use it all up or we hoard it or whatever, it won't save lives, and that's all there is to it.
No, and there are people that take it
for
its intended purpose. So there are people who have prescriptions for hydroxychloroquine.
Right? It's kind of hard to
say.
It
is. It's hard. Yeah. It's a tongue twister. But they take it every day, and they have taken it every day for a long time, but not for COVID, for their other...
All right. So there's a question about hunters. So that was something we were going to address too. The Kansas Department of Wildlife, Parks, and Tourism state at this point that non-resident hunters can come into Kansas and hunt. If they are from a high-risk state, then they have to quarantine for 14 days. Because Destiny and I love you all, we're going to say we don't agree with that either, because people are probably not going to come to Kansas, hole up in a hotel for 14 days, not go to the grocery store, not go to the gas station,
not
or anything
hunt.
else, not hunt, just to enjoy being in Kansas for 14 days in a nice small town hotel, and then go shoot things. So we actually have been advocating. There have been county health officers across the state that have written to the governor, to the Kansas Department of Wildlife, Parks, and Tourism, because we don't believe that is appropriate either. If we have to all stay in place, we don't believe that bringing people into our state is the right thing. So we're not afraid to say these things. Sorry. And if you're listening, out-of-state hunters, please stay home. I mean, we've got our own problems.
We like you. Come next year.
Next year. We'll keep the animals alive until then.
Yeah.
It'll be fine.
Yeah.
It'll be great. There was another question about when will fountain drinks be available again well, maybe we'll just address fountain drinks.
Yeah. So fountain drinks under the governor's order are not allowed. They're the same as
Buffets.
dine-in buffets and salad bars and stuff. It's people touching the same things, and that's exactly what we're trying to avoid. So as far as that happens, as long as it's active, we're going to have to drink bottled pop.
Now, fountain drinks can be served by the employee of the restaurant or bar or convenience store or whatever, but they just have to be handed to you. No one's going to serve their own.
Yeah. So the convenience stores, and I mean, honestly, they can't pay someone to stand there with gloves on and a mask and a thing and serve fountain drinks. I mean, it's an option for them, but they can't afford that. I mean, they don't make that much off fountain drinks. So.
This would be a good public service announcement that pop's not good for you anyways. Don't drink it. That's my doctor face. I didn't touch my face. My doctor face. I just said my doctor face like this. So anyways, that is a great question, because we, like Destiny said earlier, some of these things may come back as we relax some of the regulations at some point in the months ahead. And that may be one of them.
And it's going to be the same. It came on a little bit at a time. It's going to go away a little bit at a time.
Yep. Someone mentioned, and maybe this is a real question, maybe not, and we'll take whatever question. We'll answer everything. If you haven't noticed already, we'll answer literally everything. If you go to the grocery store, can you stand in the freezer with the door open and try to kill off any viruses? The answer is no. And then you're wasting good energy there with the door open. We do not see at this point with the science that the temperature has much to do with what this virus, how it survives anyways. And that comes along with, is the warmer weather going to make things better? We're not seeing that in other countries or states where the weather's already warmer, like in Florida, right? So we don't have any evidence that the weather or the temperature is really going to affect the virus.
Yep.
All right. Oh, Pete's has a person.
So yeah, Pete's apparently has a person that is making fountain drinks for people. So if you must have a fountain drink, go there.
Let's see. Oh, you guys are so nice. Alrighty. So let's talk a little bit about parks and playgrounds. Maybe since do you want to do that one?
Yeah. So I think last time we talked about, no, that was Monday. Sorry, I've had so many meetings.
I know. If you've lost track of time, it's okay.
It's okay, because
so
have we.
Yay.
This virus has gone on for a year.
It's one of those Mondays, I tell you.
Okay, so there's some different rules on parks and playgrounds throughout the county, just because we're just trying to keep everybody safe, and different things work in different places. Countywide, Jennifer has mandated that people not play on playground equipment. So
see how I'm like the bad guy.
Yeah.
No children, no playground equipment, or adults.
No fun.
No fun for you.
No fun.
Okay. Sorry.
So that's not okay anywhere, and the reason is because kids, they touch their faces and they put their fingers in their mouths and they climb all over things, and
they're kind of gross sometimes.
They're a little gross, and they sneeze on everything and cough on everything, and we love kids and we don't want them getting sick.
Yes,
they're gross,
good,
but we love them.
They're gross.
So
lovable.
So we don't want kids playing on the playground equipment, but being in the park, in Fredonia is fine, and it's fine in Buffalo and Altoona. Neodesha had a little bit of a problem with some people gathering and not dispersing the way they needed to. So that city council decided to close their public spaces and their parks. They are still encouraging, and as we are all encouraging, people to get outside when they can, just not clump up. That's the whole point. Because we want to keep that distance between everybody, and we don't want germs and viruses.
I think the outdoor conversation is a good one, because people ask about, well, can I go for a bike ride, or can I go golfing is another thing. So right now, and this is according to the state too, so I promise we aren't making all this stuff up. We only make up like 10% of the things we say. Just kidding.
15.
So we try not to make this stuff up, but we are, every day we're on calls from the state and just listening and seeing what the requirements are. So for golf courses, they can stay open. You only can have one person per golf cart. Now, we do believe if, let's say it's a husband and wife or somebody in the same household, they can be in the same golf cart, because it's the same as like social distancing if you're within the same household. But we don't want multiple people playing together. In fact, our golf course did reach out to us, and they have made great changes in, people not hanging out at the golf club or hanging out in the patio. You're not allowed to purchase food or alcohol there. You have to pay your green fees at the door. And they're actually making the cups so that you can actually get your ball out of the cup without having to touch it or touch the flag. Like there's really great stuff going on, so that we don't have to worry about germs from, like, do you wipe down the flag or whatever. So that just gets weird when you're like flag wiping. I don't know. I'm a flag wiper. Mm-hmm. So I think when we talk about non-essential travel, really we're not discouraging foot travel or like anything that has to do with exercise. It really is mostly by like motorized vehicle, so it's going to be by car or potentially by ATV. I mean, just be careful, with that kind of stuff. But yeah, please stay outside and be doing things.
Yeah, and I'll segue here a little
please.
bit. So we know that being outside and being active and getting that fresh air is important for your mental health. If you are just cooped up with your family for days and days and days.
It has been a year, hasn't it? Already.
We know that that's not going to be good for your mental health. And the longer this goes on, the more concerned that I think we all are about our own mental health and the mental health of those around us. So do things to help yourself stay well, not just physically well, but take a break from this stuff. Don't just watch it on a loop on CNN or Fox News or whatever. Stay sane, please, and get a hobby.
I know, start
trying something new.
Maybe.
Yeah, if you feel like you are losing it, call somebody.
Like,
please.
We'll take care of you.
We'll find someone.
Sorry,
we'll
doctors.
find a mental health professional to help you.
Doctors, psychologists, counselors. We've got lots of options for you too.
Yeah. So please call someone. Ford County is our mental health center here in the county. Their phone number's right on their website, because they know too this is a tough time for everybody. There's a lot of stress right now, and a lot of people that are unsure. So it's really important to stay.
And we've already, we have questions like, are you guys still seeing patients? Can you prescribe things for this? Absolutely. I mean, we're here for you. So I will say that our clinics across Wilson County, all of the clinics, and because I want to make sure it's not just a plug for mine, because all of the clinics, all the doctors, nurse practitioners, and the clinic staff, everybody is doing so great at adapting to what we need to be doing. So we're doing curbside visits. We're doing phone visits, we're doing video visits, and we're still doing in-person visits. And we're very careful with the in-person visits, where we have rooms that we reserve for well visits. We have rooms where we reserve it for sick visits. And some clinics also do special times, like sick people in the morning and well people in the afternoon or whatever. So we're trying to do all these things to keep you safe, but also still take care of you. So please reach out to your doctor, your healthcare provider, and we can help navigate the system for you.
Yes. Yes, and Kayla, you're right. Ford County is doing everything over the phone. I think maybe a little bit of telemedicine option there too. So they're still available.
I am going to just mention, since we were talking about the clinics, that our local healthcare, I guess, providers, and not just the providers, but like pharmacies and everybody else, everybody's really trying to do their part and adapt. So like both of the hospitals, Fredonia Regional Hospital and Wilson Medical Center, and we saw there was a question about the hospitals too, but both are now doing drive-through labs. So what we want you to do is talk to your doctor. If you have labs that are due, like if you're a diabetic and it's your time to get your A1C done, we can actually have you drive up. We have somebody waiting at the front desk, and this is again at both hospitals. They have somebody waiting at the front door, and you tell them that you're there for labs. They'll give you a place. They'll instruct you on where to park, and then from there you'll wait there, and then the person will come and draw your blood. So again, we are just adapting and trying to make everything happen easily for you guys, because we know that your chronic conditions like diabetes and high blood pressure or high cholesterol, those things do not wait while we have coronavirus happening. So we want to continue to make sure that you're going to stay healthy. So please remember, the hospitals are both doing that drive-through labs. Call your doctor so they can get everything ordered before you show up. And then our pharmacies are also doing delivery, curbside, and drive-through. So again, Porter's and Fredonia Pharmacy, thank you guys so much. There's just a lot of great stuff happening. There was a question about, are the hospitals prepared if people come in? Absolutely. We've already been practicing this. So even though we don't have coronavirus here, the patients that we've swabbed, we've treated every single one of those patients, and some others that we didn't end up swabbing for coronavirus. We've treated every single patient as if they have it. And then we assume they have it. We protect ourselves and protect our staff up until the point that we find that they have a negative test. And Destiny keeps track of those tests, the health department does, to know that if there's a test pending, that person who's waiting on their results, if it takes 2 to 3 days, they are not just wandering around. Those people are isolated in their homes, waiting for the test, and then until we know for sure that they're negative, they stay there, and we make sure that they stay there. So people have asked, well, what happens when there's all of a sudden a positive case here? Well, luckily that person's already been in isolation for a few days. So hopefully it's one positive case, and then hopefully it's maybe another positive case, somewhere else. But we hope that it's not just going to be that that people are infecting each other if we're doing it the right way.
Yes. And as far as from the health department, we are using the same disease surveillance software that we use for everything. So we're not bad at it. No,
they're really good.
Kara's really good at it. She spends a lot of time on there. Should we tell them about our thingy?
Yeah, tell them about the thingy. We're so
we have a really new exciting thing. Wyandotte County has been using a self-reporting tool, which is basically you follow a link and you take a survey and you answer questions. If you've been exposed to someone with COVID-19, if you have certain symptoms, they have certain questions that they ask, and it's not very long. It's just a few minutes, and that actually sends us your phone number or your email, and the nurse will get back to you. So she'll get an email if you fill out a survey, and we can get right back to you. That helps too. It helps us know what's going on, and so we are really excited about that. It goes live tomorrow, so we're really excited about that opportunity to do that.
So that also kind of walks you through what's your likelihood that you have coronavirus, and it asks your travel history and that kind of stuff. Does it?
Mm-mm.
Oh, another one does. The CDC does. But okay, never mind. There's also a CDC one. But it will kind of instruct you. It'll give you a little bit of
it asks you about if you have underlying health conditions, and it asks if you got it in a public or a private place. And if you got it in a public place, or you think you got it in a public place, then you fill that in that place. So that keeps it kind of on our radar, so we know if we have a case and we have to do a contact investigation, we know right where to start. So that is
very
really
important.
Really exciting. And nope, there sure aren't, Linda.
Yep, no cases in Fredonia.
No, and there was a question about health department doing a child's shots in the car. We're not doing that right now, and I'll tell you why. Our office is closed to the public except by appointment. And kids' shots, a lot of times, especially older kids, babies aren't as bad. They are very grabby. They're very grabby with their hands. They're moving their legs. They're kicking. They're, carry on. We need you to hold on to them. So we're still doing those in the office. Our staff is going to wear a mask just to protect you or us both, because we have N95 masks, and we'll have cloth masks as well. So we're asking people not to come in if they're symptomatic, and we're asking people to call for an appointment so we can get that done, because it is still very important that they get them done.
Wonderful. All right. My brother Mike is going to get mad at me if I don't give a shout out to Gunnison for out in Colorado, where they started doing the self-reporting first, because they got hit really hard. And just to kind of give you a glimpse of what another community looks like, they passed a mandate out in Colorado in their small town where if you are a non-resident of Gunnison County, you can actually be arrested if you are found in that county. So they got hit so hard by the ski traffic and everything that those are the extreme measures that they're taking. We don't want to do that. We don't want to arrest everyone. I mean, I kind of sometimes feel like citizens arresting people, but I don't think that I can do that. But we want to make sure that everybody can do what they want to do.
I just got a mental picture of that. It's pretty funny.
Behind your back. So anyways, we want to keep things, where people can do what they want, and just keep people safe the best way we can with information. Alrighty. Let's see. We will say, Destiny mentioned calling first. That's just something I want to remind people, that if you think that you have some sort of, actually, if you have any fever or if you have any type of respiratory symptoms, call ahead. Call the ER, call your doctor's office before you ever think about coming in. And in general, I would just say call anyways. If you're coming in for a UTI or something, call to make sure that the doctor is seeing sick patients that day, or that you aren't smushed between a whole bunch of COVID patients, So, I mean, not smushed between them, but the appointments, anyways, you get the idea. But so call ahead. And also the CDC recommends, and normally we don't say, hey, don't come to the ER, because that's kind of poor form for us to be don't come to the ER for things that aren't emergent. The emergency room truly is for emergencies, and now more than ever. So the CDC even recommends do not go to the emergency room if you have mild symptoms. So we oftentimes, as doctors in the ER, we will see people with an earache that they've had for 7 days or whatever else, or we might have somebody who stubbed their toe 3 days ago. Please, we're trying to protect everybody. So if those things can wait and be seen in the doctor's office, please do that, because that's the right place for them to be seen, and leave the emergency room for the serious things that are happening right now, because we still have heart attacks and we still have strokes, and we want to keep everybody, even those patients and you, safe.
So Lisa, yeah, we mentioned it. You
might restate it, what you asked.
Okay, so she logged on late and not many people are wearing masks. Is that something that we should be doing? She did the other day and today at the store. Good job. But not many people had them on. Really, it's kind of a new recommendation. We I don't want to say we were told.
Oh yeah,
so
it's okay.
So the first
we're keeping it real.
The first recommendation was don't wear them.
Yep.
So that's what we kind of told people. We're it's okay if you want to, but it's not going to protect you. And that's still the message. It's not going to protect you. It's going to protect other people. But now they're saying since the spread is higher, go ahead and wear them in case you're symptomatic, or in case you're not symptomatic but you have the virus. That way you're not giving it to other people. So yes.
Even though we're not seeing a lot of masks right now, what we would love to see by the end of this week even is every single person that's out in a public space, we would love to see them wearing masks, because even though it's not a mandate, that's, again, the thing that's going to help save lives in the long run. Yeah. So maybe by next Tuesday, when we have our next live, we're going to say, man, I saw everybody wearing masks at the grocery store.
Yep, I made a mask last night, and
yay.
I wouldn't wear it in public because it would be embarrassing. So I'm going to perfect that this week.
We also made masks. My daughter did, Millie, and I have worn more embarrassing things in public, so I'll probably wear it. So we do, and people are wearing masks. Like, I mean, that's good. That should be it should be a regular part of what we see these days. So please feel free to do that, and that will be important for everybody.
And I mean, this is just a shout out to those people that can sew. It wouldn't be a bad idea to make some for the grocery store employees or the dollar store employees or the convenience store employees that may not be able to. So if you're just in the mood to make masks, that would be a great place for them to go.
Yes, absolutely. And then another suggestion would be, it's not regulated at this time that you can only have 10 people, like let's say in a grocery store. But if you are going to the grocery store and you see that the parking lot is full, please just maybe swing around. We know you're not cruising, you're not going to get in trouble, but maybe just swing around or go home and come back, because as much as we can, we want to keep a limited number of people in those places that people need to go. So again, the hardware store, the grocery store, the pharmacies just drive through, but any place where people might be gathering, please just try to not go in when you know there are a lot of other people there, if you can do that.
So Laura, DIY bandana masks are just fine. They're just like the kind of fabric ones. Most of the times you fold them over a few times. So they're just as good. Pre-testing before procedure.
Of course. That would be Dr. Moberly out in Oregon. So, Rick, you have to, if you can comment on what you guys are doing. We are not currently recommending pre-testing for COVID before surgeries or other aerosolizing procedures at this point. And if you wouldn't mind commenting and letting us know what you're doing out in Oregon, because you guys were hit before us too, that would be great. So we can maybe get a sneak peek of what we might be in for.
We are pre-testing before people go into long-term care facilities.
Yes.
So like someone who is recovering from something at the hospital who has to go into long-term care for recovery, or just before they get admitted, they are being tested, and they are actually being quarantined in their rooms just to keep that really vulnerable population safe.
And I will say, you guys make the best comments about not drinking pop already and making your own masks and all this stuff, and a styling mask. I would expect nothing less, Susie. So please keep commenting. We're reading them, and we read them afterwards, and we chuckle about them, and they're great. And so thank you. I mean, all those comments, please. They are really for us. They're very encouraging, because we're trying really, really hard. And this is, I don't know if you know this. This is our first pandemic. So, it's a thing.
You couldn't tell it by watching
I know.
this, but
I think in our pandemic manual it said first make t-shirts. I think that's what it said.
Yeah.
But this is our first pandemic, and so we appreciate the encouraging words. And if there is anything that we're missing, tell him what you asked your son.
Oh, my son is 14, and he has asthma. And I asked him last night if there was anything that he had questions about that people weren't answering, because we're not hip anymore, and we're all on Facebook, and kids aren't on Facebook. They're on Instagram or TikTok or whatever they're on. And so we're not getting the younger crowd asking us these questions. So I said, hey, Grant, is there anything that you need to know about it that you're not learning? And he thought about it, and he goes, well, not really. I just want everyone to stay home so I can have a summer. So that's pretty insightful, I thought, for a 14-year-old. He kind of gets it. So stay inside so my son can have a summer.
Yes, thank you. Right? They get it, but kids get it. And make sure you're talking to your kids about this, because they're probably not on here. Maybe they are, I don't know. But so that it's not scary for them either. And that they can do their part also. And it takes kids too to do their part.
Yeah.
We mentioned, I think we mentioned the food and alcohol thing last time. And then travel, our only travel advice is don't do it. All right?
Yep, done.
We're the opposite of Nike. Don't do it. Just don't do it. And then...
Thanks, Lisa.
There were a couple questions that we got earlier also. I had someone text me about, should you clean money if somebody is if there's money exchanging. I didn't ask where the money was being exchanged, like back alleys or for what products. Just kidding, you know who you are. But also that goes along with a question that was on here about should we disinfect our mail. And so those are great questions. I don't have a really great answer for that. except that try to limit your time that you're handling money. Sure, you can spray it with Lysol if you want. It's not going to hurt anything. But definitely once you handle the money, wash your hands really well or use hand sanitizer.
Yeah, or, use a card if you can. Take your cash to the bank and use your debit card. Mm-hmm. I know a lot of people are recommended, or like KDHE and CDC are recommending that, only cards and not cash because it is so dirty.
Let's see. Dr. Moberly said, basically, if they might have a procedure that would produce aerosols and are asymptomatic, then that would inform use of N95 and other PPE for their healthcare providers during their procedure. So sounds like they're not testing, but they're being extra careful if there's a possibility. So thank you, Dr. Moberly. I appreciate you being helpful for the first time in the 15 years, 20 years I've known you. So just kidding. He's a great doctor, people. Let's see, Sherry. He told me he's needing a haircut. Grant is needing a haircut.
He told me he's trying to get a mullet. That's what he told me. He doesn't want to cut his hair because he wants a mullet. It's disgusting.
I've seen far too many mustaches and bad haircuts in this pandemic. This is why the pandemic has to end. This is not okay, people.
That's funny.
Another thing that we might bring up, and this is kind of like a really sad thing that's happening all over the country, is that people who are wearing scrubs are being attacked. There was someone in Oklahoma, a woman that was shot at the gas station for wearing scrubs, and the person that shot her was saying that she was spreading coronavirus. So we bring this up because this is a world when really crazy stuff happens, and people are scared, and people act on that fear, and it sometimes is just irrational action. We all know that that's crazy, but the person in that moment maybe is having one of those times where we talk about the mental health, that they aren't in touch with reality at that time. So be careful. If you are in a profession where you're wearing scrubs, please don't wear them out in public. That's just what we're recommending. If you can go home and change first, or if you can send somebody else out to do the chores, please do that. I am now actually wearing scrubs every day, all day, just so I don't have to do any chores out of the house. Just kidding. But they're like adult pajamas. They're so good. Man, like scrubs are the best. Yeah. Get yourself sometime after the pandemic.
After the pandemic. Yeah, so there was a question about men shaving their beards and mustaches before wearing masks. Definitely a good time to not have a beard. Beards are disgusting.
In general.
They're filthy. They're only clean right after you get out of the shower. And
her husband has a beard.
He does.
Most days.
He's bearded.
Yeah.
And usually it doesn't smell very bad. But sorry, Jace.
Sorry.
But no, especially healthcare workers, and they know this, with the N95 masks, you can't have any facial hair around your mouth. So they just don't seal. So yes, at this time, not the best time to be bearded.
All right. That's why we also shave.
Yeah, shaved mine.
I did see, and now I'm just kind of commenting on a couple of things that I saw kind of on Facebook comments, that people are saying, well, maybe this isn't so bad because there's this many deaths right now from COVID in the United States, and there's usually this many deaths from influenza in a season. Well, the answer to that is that we are not there yet. I mean, we are seeing 10 times the death rate of influenza with coronavirus. So please do take it very seriously. When we see 0.2% of people die in an influenza season in our worst seasons, and we're seeing 2% to 3% of people die with coronavirus, that's a serious disease. So please do pass that along, because we have all the information from other countries to know that this is as serious as what we think it is, if not more. So, no beards. That's a thumbs up. Oh, Dr. Moberly. Yep. And what is your opinion on still playing golf? So we mentioned that a little bit earlier. Susie, I've seen you play golf. Keep doing it, lady. It's a little fuzzy, the memories, but yes, play golf. Do not hang out at the clubhouses. It's still an outdoor activity. Only be in, if you can, one cart per person. And if you can do it just individually, and rather than in a group, that would be great. So that's our advice on that one. Yep. I was asked to mention blessing boxes. So that's something that we have in Fredonia, that we have blessing boxes in our on our square. So they are a great source. Our county, I will tell you, our county has done so great. The schools are providing thousands of meals. They've already provided thousands of meals to Wilson County. And imagine, between all the schools, it's just been amazing. So, and that's to children and adults, and those are to children 1 to 18, not even all school age children. So, just the way that our county has pulled together is just amazing. So we have that. We have food banks. We have the Mercy House, and again, I apologize because I can't speak to all the places in Neodesha. I know
they have a city food bank.
They have a city food bank, great, and they're delivering meals also.
We also hospital.
Through the hospital, right? And then we have Meals on Wheels. We have these blessing boxes that are at that are on the square. They are meant to be used for, like, if you need a few items in a day. They have granola bars or little boxes of cereal or oatmeal or whatever. They're not meant to be where you take everything, and I know that that's kind of what's happening. And so if others around the community know about this, can kind of help, and I don't mean to say police it, but just watch and make sure that they're being used appropriately, then they can help the most people throughout. And you can also make donations to these boxes. In general, they're being used appropriately. I think there's just been a couple of times, and we know that that's going to happen. And again, people are scared, and people and things will always happen like that in life, but it can't stop us from doing the good things for people that are going to need it.
Yes. And Brenda says that she saw on the news today that people who die in a nursing home are not counted in the death count from COVID-19. That is not true in Kansas. I know one of our first deaths up in Kansas City. In fact, our first death.
Yes, our very first.
Was an individual who had lived in a nursing home, and I know there is an outbreak in a nursing home in Coffee County up in Burlington, and
so they should be.
They haven't had a death yet.
I don't think they had a death.
So that's not counted because no one's died. But when anyone dies from COVID, it will be counted, no matter what. As long as we know.
A great question came up yesterday. So we also have our Monday countywide meetings where we talk with the governments, the schools, the hospitals, the clinics. I mean, again, very proud of our county. We say that every time, but we're like super proud of our county.
You guys are doing awesome.
Yeah, you guys are great. But a great question came up about how they count where the test is counted.
Yeah, so cases are reported by their county of residence. So if a Wilson County person goes to Chanute and they test positive over there, it's still a case for Wilson County. If a Chanute person gets run through the hospital lab in Wilson County, then it's a Neosho County case. So the person that's sick isn't always in that county at the time that they're sick, but that's how it's reported. We in Kansas we've had 2 out-of-state cases, and they weren't counted in our numbers, but they were on the map as like a different color until those counties got their own cases. So,
yep. So yeah, I think it's always confusing about about who gets credit for that case.
Yeah, who gets credit for it, and who has to investigate it.
Yeah.
Honestly, if Wilson County had a case tested out of state. We knew about it. We waited for the results. It luckily was negative for that person. And so then we were done with it. If it hadn't been negative, we would have done the contact investigation on that case. Even though the person was nowhere near, it would have been a complete nightmare, frankly. Yeah. But even though the person was nowhere near Wilson County, we would have done that contact investigation.
See how good our health department is? It's amazing. And so, like, that's why I want people to feel comfortable and comfortable both in the leadership of the health department and also talking to them about, I don't know if I have coronavirus, or, I think I need to get tested. Like, this is all, we're all in it together.
We are. And everyone's working together really, really, really well. Numbers and information is going back and forth between the health department and hospitals and clinics all day long. So it's really great.
Okay, we're gonna start dwindling down. We're calling last call again. I do want to mention that where we get our updates, we oftentimes will go to cdc.gov. We'll go to KDHE ks.gov. Those are our kind of go-to places to make sure that we have the most up-to-date information, and they'll give you daily updates on numbers too. And then, of course, we are going to be doing this every Tuesday at 5:30.
Until you guys are sick of us and stop watching.
Until we're just like, why isn't anyone logging in? Maybe it's the internet.
We'll just ask each other questions.
Yeah. Hey, Des, how are you? What you wearing? What you wearing, girl? Also, if you want to watch Governor Kelly's updates, where you'll get like the latest updates, like the church executive order today, for example. Every day at 2 p.m., I think Monday through Friday, not on the weekends, I think.
No, Monday through Friday.
Monday through Friday. She is on the local station, so she'll be on TV, or you can get on Facebook Live and you can watch her updates there. And on Monday, Wednesday, and Friday, our Secretary of Health, Secretary Norman, is on there with her too. So there's lots of places besides us where you can stay informed. I mean,
the information's not quite as good, but
I know.
But it's close.
I mean, they could be experts, I guess, but they're definitely not as entertaining. That's all I'm saying. But any other questions?
Nope.
I don't think so. Okay. With that, we will plan to sign off, and we'll see you guys next Tuesday. All right.
And if we missed any questions, we try to answer them afterwards. I wanted to say that too, because we see your comments scrolling through, and sometimes we miss questions, but not on purpose. So
yes, we also are homeschooling so that we can read faster. And again, thank you. I'm going to give a shout out to our teachers, our administration for all of the schools, and our parents who are all of a sudden teachers. We know it's hard. Everybody's in this together, and it's hard for everybody, the students, the teachers, the parents. Please keep at it, ask questions, communicate well, and we will definitely get through this.
Mm-hmm.
All right. Otherwise, call Destiny with problems. Okay, bye-bye.
Call me, I don't care.